My name is Mathew. I work for the National Ministry of Health as a Director for Emergency Preparedness and Response. Do you get me well? The presentation will focus on the process of establishing the rapid response team in South Sudan, the experience and the challenges that we are facing in our process. So to start with, as the background of South Sudan, we know the crisis that started late in 2013 has posed dire humanitarian need in South Sudan. And to respond to many health events that are happening in the country, in 2014, the Ministry of Health and WHO plus partners have come up to strengthen the capacities or to commence the establishment of the rapid response team in the country. And we started the trainings in the country using the previously developed material by WHO, and we started with the National Rapid Response Team. The first training was TOT training, in which we train a pool of experts whom we can use to cascade the training to the lowest level. Not forgetting this is in line with the Afro strategy for disease surveillance, which is the integrated disease surveillance and response. The ideas are that we are implementing at the soil surveillance system in Afro, and South Sudan is a part of the Afro region. We adopted the surveillance strategy in 2006. 2018, the WHO also conducted the regional rapid response team that was conducted in Uganda, and South Sudan was having privilege to have 10 members in that pool of experts. And when they came back in October 2018, a TOT training also was organized in the country in Juba level. And this training, it was a TOT training also to cascade the training to the lowest level. So the next step, once we have the national training as a TOT, we move into cascading the rapid response team training to the lowest level. The structures in South Sudan, we have the national level, we have 4 levels of governance. The national level, we have the states level, we have the counties level, and then we have the PAYAMS level. So after the national training, the training was cascaded into the state level, and we have more than 32 states in the country which are being merged into hubs, and we have 10 state hubs in the country, and all the 10 state hubs we conducted the training of the rapid response team in those areas. So now we can probably say we have a rapid response team in each and every of those states, and the Ministry of Health is working very closely with the partners, WHO supported, and other implementing partners to make sure that the rapid response team are responding to public health events that are happening in the country. So far, the rapid response team in the country have responded to many suspected outbreaks in the country. These include the cholera outbreak, the massive one that hit the country in 2014 up to 2017. Luckily enough, until now, we don't have a cholera cases reported in the country. The rapid response team as well responded to Rift Valley fever that occurred in 2018. We also have the hepatitis E that is happening in one of the humanitarian settings in Mathew, and many more suspected public health events that are happening in the country. Measles as well is one of the outbreaks that is happening now, and we have a team that is always going to the ground to give support to the state's rapid response team. The trainings of the rapid response team have occurred graciously by support from WHO country office, and the partners and donors who are supporting these efforts are USAID. So the material was simplified to the context, and we make sure that the people understand what's supposed to be done on this regard. And the TORs as well has been developed for the context of South Sudan to make sure that each and every member of the rapid response team knows what it's supposed to be doing when it's deployed in the team. Few challenges, of course, have occurred. These challenges include the high attrition rate of the staff, and sometimes we face challenges if we train people this year. Next year it's very difficult to make sure that the same people are in place. And the second thing also, the language barrier. The more you go to the lowest level, the more the English language is not highly practiced in those areas, and that's why we make sure that simple Arabic also is being included, though the material are not translated in Arabic, but the facilitators use simple Arabic. Last but not least, the sufficient logistical arrangement also that used to hinder and delay the deployment of the team is one of the issues, though we are working very hard with the partners and WHO in driving seats to make sure that the RRT is doing its best. To conclude with, the experience and challenge have given us many lessons to learn during the rollout of the rapid response team to the lowest level. And the Minister of Health, with the technical support from WHO, have outlined a roadmap to streamline the trainings and organize a new phase of the rapid response team implementation in South Sudan. Currently, the WHO is working with donors community to make sure that to reduce the high attrition rate of the staff, there is an approach to introduce incentive for the rapid response team so that when they are needed, they will be in the place. And the training also need to be supplemented with simulation exercise, mentorship, and this to ensure that the rapid response team are better skilled and more effective in their work, and thus ensuring the more robust system for investigation and response to major outbreak and emergencies in South Sudan. Thank you very much, and back to you.